In domino heart transplantation, the donor receives heart-lung transplantation. The excised heart is transplanted to another recipient so that the donor for recipient of domino heart transplantation is alive, unlike the conventional donor who is brain dead. In one report of 10 cases of domino heart transplantation, 1 year survival of donor was 60%, while that of recipient was 90%. It is worthwhile noting that donors had terminal cardiomyopathy, mostly primary pulmonary hypertension, one case of Eisenmenger syndrome, and one each of systemic fibrosis, bronchiectasis, and bronchiolitis obliterans, while recipients had either ischemic heart disease, cardiomyopathy, or valvular heart disease.